Right. Hi. Good evening, everybody. Good morning and good afternoon, wherever you are. Today we're going on the session where you are following our South and Southeast Asia Climate and Health Response course, session 10, Advising Climate Justice through Climate Change Communication, Engagement, and Advocacy. All right. So the course objective is to enhance the knowledge of and confidence and communication abilities of current and future health professionals concerning the climate crisis, to improve population care and public health practice, and serve as a credible advocates within institution, communities, and professional domain. Equip interested current health professionals with the knowledge and skill needed to educate their institution own learners so that health effect of climate change and emergency preparedness can be incorporated more easily into pre and post licensure training across the globe. Build and strengthen an agile and informed community around climate and health, education, advocacy, and policy for health professionals with strong mentorship and expert support. This is the session number 10, Advising Climate Justice through Climate Change, Communication, Engagement, and Advocacy. So there's one more session left. So this session, learning objective, discuss climate and environmental justice concept, including incorporating traditional knowledge and protecting vulnerable communities, and enhance ethical framework and address responsibilities to future generation and environment. Apply effective communication skill with stakeholder about climate and health topic by defending the target audience, listening and developing audience appropriate messaging. Communicate and share information and responsibility effectively at different organization level to gain political commitment, policy support, and social acceptance for climate action. Explore the connection between climate change, awareness, and ecological anxiety, and the use of an incentive to empower individuals and communities to take climate conscious changes. Demonstrate how to enhance theories of collective and transgenerational ethics, which emphasize society's responsibilities to future generation and environment by incorporating a perspective that focus on individual well-being, present-day concern, human-centered ethics, justice, and traditional knowledge in the context of climate and health. The session is 90 minutes, includes expert lecture and case presentation, session with cumulative question and answer session. Enter your question for the presenter in the Q&A. Session video recording, slide deck, and resources will be made available on the course website. Attendance is automatically recorded during the live Zoom session. Your individual attendance is only counted if you join using your personal Zoom link. Your attendance is not counted if you join with a colleague's link. YouTube view will not be counted towards the attendance. Certification of participation. Participants who attended at least 7 out of 11 live Zoom sessions and passed the final exam with a score of more than 50% at the end of the course will be awarded a certificate of participation in climate and health from the GCCHE. Note, the certificate of participation is only available to people who use the same email for registration, or Zoom session and exam. Final examination must be completed using the same email address used in the attendance to the Zoom session. The exam link will be sent on the final day of the class via email and WhatsApp, and will close on Sunday. Format 25 multiple choice true-false question. Participants should be prepared to take exam in one sitting. We are fortunate today. We have 3 speakers. First with Dr. Popular Djandam, climate change adaptation and natural resource governance expert. Then we have Melo-Rijk, regional climate and health manager, healthcare without harm, and Laetania Belai Djandam, youth indigenous planetary health practitioner, Dayak Laju Mayan tribe of the Borneo, Indonesia. So without further ado, I would like to invite Dr. Popular Djandam to start the session, but I would like to introduce him. All right, let me introduce Dr. Dr. Popular Djandam. All right, Dr. Popular Djandam is a climate change adaptation and natural resources governance expert. Stop presenting. Oh, okay, I've stopped presenting, correct? This is not mine. All right. Popular has over 25 years experience in working at the intersection of research, policy, and program focused on climate change adaptation, natural resource governance, and livelihood and social inclusion. He holds a PhD in climate change adaptation and from Charles University, where he is also an adjunct senior research fellow and has a master's degree in forestry and ecology. His role have included serving as climate change and environmental advisor for the Prime Minister of Nepal and holding a leadership position with CARE International, Oxford Policy Management, and IPAS USA, with numerous publications on climate and livelihood and governance. Can I invite Dr. Djandam to continue and share your slide?
Thank you. Thank you very much. Is my slide visible to everyone?
Not yet. There's the folder is visible. Whose folder is that? Popular is your folder. Yeah. Your slide is not visible. Only your folder is visible. Are you okay? Can you find your slide, Dr.
Yes.
Okay, it's visible now. You can start presenting.
Is it okay now?
Thank you very much. Yes, it's visible.
Okay, thank you. Thank you very much. I'm pleased to be a part of this important course. And we are in the session 10 that is about advancing climate justice through climate change communication, engagement, and advocacy. I'm not going to read the session objectives. Victor has already discussed this. So let me start my presentation from how we define the climate change. You all know and you are familiar with the climate change, but let me share some of the definitions of climate change. Climate change refers to long-term shifts in temperatures and weather patterns that in the long run will completely alter the ecosystem that support life on the planet. And human activities are the main drivers. The anthropogenic causes are the main drivers of climate change. And major drivers are energy use, industry, transport, buildings, and agriculture. This causes the release of greenhouse gas to the atmosphere. And the consequences of climate change are already manifested in our life and livelihoods in terms of severity of droughts, water scarcity, wildfires, rising sea levels, flooding, melting polar ice, and many catastrophic events, including declining biodiversity. Let me start from who are primarily responsible for greenhouse gas emission. The major contributors for greenhouse gas emissions are some historical greenhouse gas emitters such as USA, European countries, and Japan, and some emerging industrial countries such as China and India. The top greenhouse gas emitters that includes China, USA, India, EU, Russia, Japan, Brazil, Indonesia, Iran, and Canada. They contribute over 2/3 of global greenhouse gas emissions. And only the top 3 greenhouse gas emitters, those are China, United States, and India, they alone contribute 42.6% of total emissions. On the other hand, the bottom 100 countries that mostly include the developing and least developed countries, they only account for 2% 4.9% contribution of the greenhouse gas emissions. This is the scenario of greenhouse gas emission. So let me discuss who are suffering more from climate crisis. Everyone in the world are suffering, but who are more suffering is very important from the justice perspective. The developing countries and marginalized communities are disproportionately vulnerable to the climate crisis and facing significant socioeconomic impacts and heightened risk of extreme weather event. Economy of developing and least developed countries is fragile, and it mostly depends on climate sensitive sectors like agriculture and water resources, which has consequences, which is susceptible to the consequences of climate change. The developing and least developed countries are more exposed to the impacts of climatic hazards, including more frequent and intense floods, landslides, droughts, heat waves, cold waves, and storms. Extreme weather events and changing environmental conditions have a negative impact on crop yields, leading to food shortage, rising prices, increasing the spread of infectious disease, and worsening existing health problems. An annual average of 21.5 million people been forcibly displaced by weather-based sudden onset hazards, such as floods, storms, wildfires, extreme temperature each year since 2008. And majority of these events are in developing countries, and those who are most suffering are poor and marginalized people. According to WHO, air pollution is the largest cause of disease and premature death in the world, with more than 7 million people dying prematurely each year due to pollution, mostly in under-resourced settings. That means in the developing, mostly in developing and underdeveloped countries. Climate change costs the world 12% in gross domestic product losses for every 1.1 degree centigrade of warming. So every 1 degree centigrade of warming is now causing 12% loss in gross domestic product. And the adaptive capacity of developing nations and marginalized communities is low. It is basically due to lack of adequate information, resources, technology, poor social networks, and poor adaptive capacity. According to UN, between 2010 to 2020, highly vulnerable regions, which are home to approximately 3.5 billion people, they experience 15 times higher human mortality rates from floods, droughts, and storms compared to regions with very low vulnerability. The crisis exacerbates economic disparities between countries, hindering poorer nations' ability to provide basic services and invest in sustainable development goals. And climate crisis intensifies competition for scarce resources such as food, water, land, forest, and that is restricting access for the poor and heightening socio-economic inequalities. Adaptive capacity of developing nations and marginalized communities is low. So this is the situation that reflects the situation of injustice. So the topic of today's discussion is climate justice. The climate justice recognizes the disproportionate impacts of climate change on low-income and socially marginalized communities around the world, the people, the places least responsible for the problem. The concept of climate justice originated from environmental justice theories, and it builds upon principles of social and environmental justice and advocates for equitable solutions that address both the climate crisis as well as the existing inequalities. There are four major conceptual dimensions of climate justice. Number one is the unequal responsibilities, and it discusses who bears greater responsibility for the emissions of greenhouse gases. Second is unequal impacts of climate change, and that means to discuss who is more adversely affected by extreme weather events that will increase in frequency and intensity. And third one is unequal impacts of policy responses, who benefits and who bears the costs and burdens of mitigation and adaptation policy. And the fourth is the procedural justice, who has the power to make and affect policy responses to climate change. So these four dimensions, they justify the conceptual part of the climate justice. So climate justice has been recognized by global policies such as the UNFCCC promotes common but differentiated responsibility. That means developed countries have a greater responsibility to address climate change due to their historical emissions and higher capabilities. The Paris Agreement aims to limit global warming below 1.5 degrees Celsius above pre-industrial levels. That means building resilience and reducing vulnerability to climate impacts and securing finance and support for low carbon and climate resilient development, considering disproportionate effect of climate change on vulnerable communities and nations, leading to climate injustice. The Intergovernmental Panel on Climate Change, IPCC, recognizes three core justice principles associated with climate justice. These are distributive justice, procedural justice, and recognition. Distributive justice refers to the allocation of burdens and benefits among individuals, nations, and generations. The procedural justice focuses on fairness of processes and procedures and refers to who decides and participates in decision making. And recognition entails basic respect and robust engagement with and fair consideration of diverse cultures, perspectives, and experiences of those impacted by climate change. So the climate justice advocates for some human rights, equity, and just transition related elements. The equity means putting the most vulnerable at the center by emphasizing fair distribution of cost and benefits of both climate change and actions, including intergenerational equity. The human rights linking climate change impacts and actions with human rights, such as right to education, right to health, food, water, and a healthy environment. The participation advocates for a meaningful participation of the marginalized and voiceless people in the decision making, and just transition, ensuring fairness, equity, and protection of rights of local, indigenous, and vulnerable communities during a transition to low carbon economy. When we discuss about the climate crisis, we mostly refer the triple planetary crisis. Those are the crises created by climate change, biodiversity loss, and pollution. These three major issues are interlinked and currently causing humanitarian crisis globally. So while addressing the climate crisis, we have to better understand the interlinkage between these three major crises and their connectedness. Let me discuss a few points about climate change and health risks. According to WHO, climate change directly contributes to humanitarian emergencies from heat waves, wildfires, floods, tropical storms, and hurricanes, and they are increasing in scale, they are increasing in frequency and intensity. And research shows that 3.6 billion people already live in areas highly susceptible to climate change. Between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year from undernutrition, malaria, diarrhea, and heat stress alone. The direct damage caused to health that exclude cost in health determining sectors such as agriculture, water, and sanitation is estimated to be between $2 to 4 billion per year by 2030. And areas with weak health infrastructure, mostly in developing countries, will be the least able to cope without assistance to prepare and respond to the climate crisis. And reducing emissions of greenhouse gases through better transport, food, and energy use choices can result in very large gains for health, particularly through reduced air pollution. This is a diagram prepared by WHO to show the linkage between climate change and health risk. And there are three major drivers which are causing the health risk. Those are the vulnerability factors such as the geographical, socio-political factors. And there are climate-related hazards such as extreme weather events, heat, sea level rise, air pollution, and water scarcity. And there is exposure to the people and communities, health workforce, infrastructure, energy systems, etc. So these three drivers, when they interact, when they combine and compound, they cause some negative health outcomes, such as injury and mortality from extreme weather events, and health-related illness, respiratory illness, vector-borne diseases, malnutrition, mental and psychosocial health, etc. There is also injustice in climate actions. The current path of climate action is falling behind, requiring a significant course correction to achieve the goals of the Paris Agreement. The climate crisis is not being addressed equitably. The burden of adaptation and the cost of climate change fall disproportionately on developing nations and marginalized communities. In contrast to a higher need for global climate finance in developing and low-income countries, the availability and distribution of climate finance is unevenly distributed. For example, between mitigation and adaptation, where the adaptation is the most priority of the developing nations, but the mitigation and adaptation with an extremely high allocation for mitigation is the priority now, and developed and underdeveloped nations with many times higher in developed countries. So the resource distribution is mainly to the mitigation and in the developed countries at the cost of underdeveloped nations. Developed and industrialized countries are not either taking actions as committed in the Paris Agreement or fulfilling their commitment to allocating resources for adaptation, mitigation, and loss and damage. Developed economies are continuously mobilizing climate finance from private sources, while flows continues to fall short of needs in developing and low-income countries. According to CPI, in 2021 and 22, less than 3% of the global total, that is the USD 30 billion, went to or within LDCs. The 10 countries most affected by climate change between 2000 and 2019 received just 23 billion US dollar for less than 2% of the total climate finance. So there is a need to advocate for climate justice. So I am also going to discuss some advocacy measures that can help for the poor and marginalized countries and underdeveloped countries for their common voice, for their amplified voice for climate justice. Advocacy refers to efforts aimed at influencing decision makers and mobilizing public support for global issues. particularly in relation to sustainable development and human rights. And advocacy is a deliberate process of influencing those who make decisions about developing, changing, and implementing policies. WHO defines advocacy for health as a combination of individual and social actions designed to gain political commitment, policy support, social acceptance, and systems support for particular health goal or program. There are few steps suggested. There are different ways of doing advocacy, but there are few steps suggested as part of the advocacy process. For example, defining the problem, identifying the stakeholders, mobilizing resources, formulating the argument and messages, delivering the messages, considering the window of opportunity means the political economy, building partnerships along the way, and monitoring and evaluating the progress. So these are the common steps that apply for advocacy for climate justice. So while we do the advocacy for climate justice, we have to determine some key asks. That means what is our position and which positions are our bottom lines to claim the climate justice. So here are some examples. Those indicate our ask for climate justice. There is a need to advocate to keep global temperature below 1.5 degree, which is vital for people and nature, which is already defined in the Paris Agreement. And delivery of 100 billion US dollar per year by 2025 to developing countries. Well, that is already defined in the UNFCCC as NCQG, new collective quantified goal for climate actions. And doubling the adaptation finance, and half of the climate finance flows to adaptation. That is another ask. And protect people from climate disasters with early warning system, fully operationalize loss and damage fund, and address the concerns of the most vulnerable and marginalized people, including women, youth, children, disabled, indigenous, and local communities. And there are some key asks for locally led adaptation. When development partners are practicing the community-based adaptation for a long time, there is some critical review on community-based adaptation, and locally led adaptation is emerging as climate justice. So the key asks related to locally led adaptation are devolving decision-making to the lowest appropriate level, addressing structural inequalities faced by women, youth, children, people with disabilities, displaced, indigenous people, and marginalized groups, providing patent and predictable funding that can be accessed more easily, investing in local capabilities to live in institutional legacy, building a robust understanding of climate risk and uncertainty, flexible programming and learning, ensuring transparency and accountability, and collaborative action and investment. So in relation to key asks for advocacy related to climate change and health, the IPCC annual report 6, that is 2022, that has indicated few areas which are key asks for climate change and health related advocacy. That includes strengthening resilience of the health sector, protecting against exposure, for example, with heat action plans that include early warning and response systems, improving access to potable water, reducing exposure of water and sanitation systems to flooding and extreme weather and climate events, and improving early warning systems, improving surveillance and access to mental health care, and monitoring of psychosocial impacts from extreme weather and climate events, and integrating adaptation approaches that mainstream health into food, livelihood, social protection, infrastructure, and water and sanitation policies, that is implementing multi-sectoral health governance. So these are the few indicative points that mention in the climate change and health sector on assessment report 6 of IPCC. So in my presentation with referring you some important document that I have already mentioned. Please go through the references for detail. So in summary, climate change is disproportionately impacting people who are already poor, who are already vulnerable, and who are living mostly in the developing countries. So they need justice. They need justice, and there are some measures for the collective voice, for the advocacy to gain the justice. So this is all about my presentation. Thank you.
Okay, thank you very much, Dr. Gentle. And Dr. Gentle actually have provided 5 key points: understanding climate change and its appropriate impact, concept and dimension of climate justice, climate change and health risks, injustice in climate action and finances, and finally he summarized it in advocacy and policy priorities. Now let us move on to the next session. Next speaker, which is Melody. So Mel is a climate and healthcare professional, passionate about the link between climate change, food security, and health, with expertise in environmental science, nutrition, and sustainable food system. She has led projects on sustainable consumption, global food security, climate resilience nutrition. Her work with WWF and other organizations has shaped strategies to address how climate variability disrupt food supply, change, and health. As an experienced project manager and policy advocate, Mel advocates climate adaptation at the national and global levels. A dynamic speaker and facilitator, she empowers communities to tackle food security challenges in a warming world. She is licensed environmental planner, registered nutritionist and dietitian, and holds an MBA, bridging the multidisciplinary approach to creating healthier, sustainable future. Without wasting time, let us invite Mel to start her presentation.
Thank you, Victor, and hi, everyone. Welcome to this session. I am very much delighted to have this opportunity to share our one of the many works of Healthcare Without Harm. So the title of my presentation is Right for Their Lives, Health Professionals Advancing Climate Justice for Filipinos and Everyone's Right to Clean Air. And this, as I've mentioned, this is just one of the many areas of concern that we work in Healthcare Without Harm. So to start, just to introduce our organization in the next slide, please. So Healthcare Without Harm is an international organization that has different regional offices and teams across the globe. We have one in United States, we have one in Europe, we have one in Latin America, and here in Manila, Philippines, we have Healthcare Without Harm Southeast Asia. So for the past 3 decades, we have been advocating for environmental and health justice. And we have a global community of sustainable healthcare experts, strategic partners with a common goal, and that is to have healthy people on a healthy planet. So in the next slide, I will just like to share what is the vision of Healthcare Without Harm. It's mainly the transformation of the healthcare sector so that it reduces its environmental footprint, becomes a community anchor for sustainability, and more so, a leader for the movement of environmental health and justice. For our mission, we do this being champion of people's right to health and healthy environment. We work with the ministries of health. We work with our networks of hospitals, the Global Green and Healthy Hospitals, and our network of health professionals, the Rise Alliance for Health and Climate, to transform the health sector in which we can ensure that there's a balance of the immediate needs for mitigation, resilience, equity, while serving as a leader in the broader shift to a just low carbon economy. So before I go to the campaign that we worked on last year, I want you to focus on this picture. So in the next slide, I want you to picture a world that the simple act of breathing comes with a price tag, wherein, like a regular commodity, like a scarce one, you need to line up and buy for it. And people have to stand and buy a can of fresh air, for example, to live for another day, because the world you live in becomes polluted and toxic. And children cannot go and play, and there's no wind that is blowing over them. And there is a sense of injustice, especially for the poor, who is stifled by a system that turns the most fundamental human need into a product, and that is clean air. Or imagine a world, in the next slide, you see there that in order for you to step out of the world, you need to seal yourself in a bubble that, because of this bubble, it protects you from the toxic air that might surround you. And your children, again, can no longer freely roam around, play, and people move in enclosed, disconnected, isolated, and suffocated, not just by the air, but by the loss of what it means to live freely. So these two pictures that I've shown might be a good plot for a science fiction movie. But you see, it's really a scary possibility that we must act immediately, because we see this as a terrifying reality, not only for the present, but also for the future generations. And we have to choose a different path for this scenarios not to happen. So in the next slide, I will give you a prelude of the context in the Philippines about having clean air. So, in the Philippine context, the Clean Air aims to establish a national program with the focus on air pollution prevention and encourages public participation and promotes sustainable development. So, 25 years ago, the passage of the Clean Air Act of 1999 came to fruition because of the combined efforts of different civil society organizations, environmentalists, coalitions, the academe, and other nonprofits, to ensure that there is really a certain policy that would protect and ensure clean air for every Filipino. And last year it was the 25th anniversary of this the enactment of this law. That is why we want to continue to emphasize that clean air is really a fundamental right, and we continue to foster collaboration to ensure that the guidelines that are set in the law are being implemented. And in this case, there are some things that needs to be changed. So we see that for the Philippine Clean Air Act, it's really a comprehensive air pollution control policy of the country. And this is spearheaded by the Department of Environment and Natural Resources, and also combined with the efforts of the Department of Health. So why did we need to have the Clean Air Act? So in the next slide, I have here a picture of the Philippines. So I use the iqair.com website, wherein if you look at it from afar, you may see that we have moderate air pollution. But if you come closely, so there is already unhealthy for at-risk groups in certain populations, most especially in the urban setting. And we don't want that to happen, that we increase or worsen the magnitude of the crisis, because we see that air pollution is really an invisible but deadly enemy. And we really want to have concrete data and science-based recommendations for our government to really change some of the provisions in the law. So in the next slide, I want also to emphasize that for the air quality in the Philippines, particularly for the particulate matter 2.5, our concentration is three times higher than that of the WHO standard. Hence, it is an understatement that there are 7 million Filipinos, or roughly 100 in every 100,000 Filipinos, die annually because of air pollution. And in the next slide, this just clearly shows the health impacts of air pollution in our lungs, heart, and brain.
And brain. Its deadliest weapons are invisible, poisonous particles that can be as small as a molecule. With every breath, they break through your lungs' protective barriers. There, they trigger inflammation as your system tries desperately to fight back. But these tiny intruders penetrate those defenses, lodging toxic compounds even deeper, sowing the seeds of cancer. They slide straight into your bloodstream, sabotaging your entire body. They inflame and constrict your blood vessels, increasing blood pressure until, one day, causing a stroke. The particle prowlers dislodge fatty plaque that may have built up from your diet. They weave clots that can be deadly blockers of blood flow to your heart or brain. With each new case of heart attack, stroke, lung disease, or cancer, air pollution adds another life to its hit list. Let's stop this invisible killer.
Okay, thank you. Thank you for playing the video. So this is just one of the many resources that I saw regarding air pollution, but I see that in 1 minute, this resource was able to really capture the health effects of air pollution, most especially for vulnerable groups such as children and elderly. So in the next slide, I want to emphasize that for climate change and air quality, there's really a very direct connection between the two, and they impact each other in a sense that when temperature rise, the level of air pollutions all level of air pollutants rather goes up, and heat waves and other climate related events such as wildfires worsen air quality. And in turn, these air pollutants, such as carbon dioxide and other gases that come from the burning of fossil fuels, also accelerate and are the major drivers of climate change. Therefore, we see that there is an urgent need for justly transitioning away from fossil fuels, investing in clean energy technology, and reduce air pollution to protect public health. In the next slide, we want to highlight that one of the simple and practical ways for us to do it is to highlight the critical role of sustainable transportation in air pollution. With cycling being one of the most sustainable and low emission modes of transportation, does not only promote environmental health but also contributes to physical well being. But I would like to put on the context that in order for us to really promote active transport, we have to have an enabling environment wherein we can really do that. And for the Philippines, efforts have been done to promote active transport, but much still needs to be supported in order for us to really achieve the promotion of active transportation. So hence, we have here the Ride for Their Lives campaign, Bike for Clean Air and a Healthy Future. So this campaign aims not only to raise awareness about the dangers of air quality, but also poor air quality, but also demonstrate the healthcare sector's commitment to driving tangible changes in policy and practice towards sustainable development and healthier lives for the Filipinos. While we celebrate that we have the Clean Air Act, we have that progress. It's also a push for us for urgent reform. And this campaign really calls for policy change and investment on air quality management and monitoring. So just to show you the proponents of this campaign, so this campaign is really a product of the shared voices of the following organizations. So Healthcare Without Harm. We also have the Alliance for Climate and Clean Air Philippines, wherein it's a composition of the different medical organizations. We have 350 Pilipinas and the Institute for Climate and Sustainable Cities. And this is supported by the two leading agencies for the Clean Air Act, which is the Department of Health and DNR in the next slide. Okay, so the question is, why do we need to mobilize the health sector in the context of air quality management, air pollution, and having clean air? So we see that health professionals are trusted voices in such a way that in their participation in advocacy, it really sends a powerful message to the public and policymakers. And we see that their contribution in such conversations is very much critical and very much important in shaping the societal behavior and policy direction that we have, most especially here in the Philippines. And with this, the RISE Alliance for Health and Climate in Southeast Asia came to fruition. So this alliance was formed in 2020, and it's composed of health professionals and climate advocates coming from various countries in the region, including the Philippines, Indonesia, Malaysia, Taiwan, and Singapore. So for the Philippines, we have an initiative called the Health Alliance for Climate and Clean Air Philippines. So this is basically launched on in 2023, and the aim of this initiative is to really increase the awareness and the impact of air pollution and climate change in general in terms of our health. There is also a conduct of some researches in the area and advocacy for better policies and guidelines to safeguard public health in the Philippines. So the HACCAP, or we call it HACCP, is comprised of different medical organizations such as the Philippine College of Chest Physicians, Philippine College of Physicians, so on and so forth. Next, please. So because of the Ride for Their Lives campaign, we were able to have a statement of commitment and collaboration. But this is not just a mere statement, because after this signing of the collaboration, follow-up discussions were already conducted. So this is an initiative of Healthcare Without Harm and the rest of the proponents of the Ride for Their Lives campaign, wherein we gathered 46 organizations and the two government agencies to support the statement. And basically following this event, there were already steps that were taken to discuss together with the Department of Health, the Department of Environment and Natural Resources, and the health professionals to find ways to improve our existing policy and identify ways of working and collaboration. So, what are the calls to action of the Ride for Their Lives campaign? So, there are 4 calls to action for this campaign. The first one is we really need to update our national air quality standards because it does not match the 2021 WHO latest recommendation. It might require a phasing approach, but it is really essential for us to do so. The second call to action of this campaign is really to invest and significantly enhance our systems in terms of air quality monitoring, have more transparency, and basically access real-time data information for us to really know what is really the air quality that is being monitored in a specific area. So ensuring also that there will be strict implementations of these policies and standards that is very much essential for public health protection. The third call to action for this campaign is really to promote active transport for not only for the environment but also health benefits, so including reduced rates of our chronic diseases, most especially non-communicable diseases that is directly related to lifestyle. And basically, we also want to create a safer, more accessible infrastructure for active transportation in our respective communities. And lastly, we want to advocate for stronger international policies and cooperation to emphasize that there is really a need for equity and support for vulnerable communities disproportionately affected by these issues. So, in my last 2 slides, I want to emphasize that for this campaign, we don't see it just a campaign, but it is a movement and also a declaration for the health professionals that are not really just confined to the hospitals or the clinics and just serving the people and their patients, but they are now out there in the streets, in policymaking halls, in the Congress, and in the communities to support such advocacies. And we are riding for climate justice that is intergenerational justice. We are riding for clean air. We are riding for our children. We are riding for the future generations of Filipinos. But most importantly, we want to raise our hope that in every push of the pedal that we did for this campaign, for this movement, every voice were raised, every health worker who stands are being heard. And this is not just for the treatment of diseases that are caused by air pollution, but also for the prevention and transformation. So this is our prescription for a healthier and a just future. That is fewer emissions, cleaner transport, empowered communities, and really a nation that protects its citizens and their environment. In my last slide, I want to say that we will continue to work alongside with the other organizations who believes that clean air is for everyone. And sometimes for these types of movements and for these shared advocacies, it takes courage, compassion, and conviction. And we will not stop until every Filipino breathes clean air. And climate justice is not just a campaign or a movement, but a lived reality that is deserved by everyone. So with that, thank you very much. And thank you for sharing this platform to give one of the many inspirations that would help us for the betterment of our world, for the betterment of our health, and the betterment of the environment. Thank you very much.
Okay, thank you, Mel. Thank you, Mel, for sharing an interesting slide and talking about air pollution as a public health emergency in the Philippines, and climate change and air pollution are interconnected crises, and health sector role in climate advocacy, and looking at collaboration, campaign, and alliances, and at last, finalized call for action for policy and systemic changes. Now we'll move on to our final speaker for the night. Final speaker, all right, is Laetania Belai Djandam. So Belai is a young indigenous planetary health practitioner from the Dayak Naujil Mayan tribe of Borneo, Indonesia, with a degree in medical science and experience in international climate health organization. She has held roles including Associate Board Chair at Health in Harmony and Climate Officer at Healthcare Without Harm, Southeast Asia, working to build climate resilience and equitable health system, passionate about planetary health, indigenous rights, and community-led forest management. Belai advocates for integrating system thinking and empowering healthcare professionals as climate advocate. Please start your presentation on regenerating rainforests by listening to communities. Thank you very much.
Thank you so much, Victor, and good evening from Bogor, Indonesia, everyone. My name is Belai, and it is a pleasure to be joining you for today's discussion. I will be delivering a case study on regenerating rainforests by listening to communities. And I wanted to start by grounding ourselves in a quote from Dr. Nicole Redverse that goes, "We cannot solve complex problems from the same worldview that created them in the first place, as it will continue to perpetuate a disconnect between us and the planet as relatives." What has brought us to this point of the climate crisis is a mindset of extractive, colonial, capitalistic, and dismissive view of our home planet, and we cannot rely on the same powers that caused this crisis to solve it. We need a new worldview, or rather, we need to return to the old indigenous worldview that communities know best, to restore our balance with the earth and to solve the crisis in a manner that is regenerative and equitable for all. I join you today as an Indigenous Dayak youth and the Advocacy Program Coordinator for Health in Harmony. We are a 20-year-old planetary health organization working alongside rainforest communities, employing a proven model for reversing deforestation. We work with Indigenous peoples, Afro-descendant peoples, and local communities across 4 continents, beginning in Indonesia, in West Borneo, and then expanding to Madagascar, the Brazilian Amazon, Panama, and most recently with the Democratic Republic of the Congo. You may be asking, why should a planetary health organization focus on forests? Well, you should know that tropical rainforests are life-giving ecosystems for all of us. They're actually a very incredibly biodiverse ecosystem. They are also 40% of the Earth's terrestrial carbon sinks. And a figure that really blows my mind, communities manage nearly 300 billion metric tons of carbon, a figure that, if released to the world, could be catastrophic. And all of this being part of the reason why, no matter where we live, no matter who we are, our health is intimately tied to the existence of these rainforests. From being a source of livelihood to those living close to the forest, to its planet cooling impact that protects the health of everyone. Health and Harmony's approach is therefore essentially this figure. Starting from the top, we're bridging global resources and funding directly to rainforest communities' hands, which then improves their community thriving and well-being, allowing them to continue their stewardship in protecting our rainforests and biodiversity, and that in turn stabilizes climate through carbon dioxide drawdown. Now, as we gather here today to talk about community engagement, I want to invite you to meet one of the planet protectors that we work with, Ibu Lina from Indonesia.
Pesan saya sama anak-anak, nanti ke depannya hutan terus dijaga, supaya hutan itu tidak hilang kemana-mana. Karena di hutan itu banyak manfaatnya, seperti bambu, saya paginya masak, nyuci piring. Setelah itu saya siap-siap pergi ke hutan untuk ambil bambu. Cuma itu aja sehari-hari. Siap-siap, istirahat, makan, langsung buat anyaman sama kawan-kawan. Hasil saya menganyam bisa membiayai anak sekolah, seperti jajannya setiap pagi. Dari datuk nenek memang orang sini, sampai mama orang sini, saya juga lahirnya di sini. Saya membutuhkan hutan karena bahan bakunya banyak di hutan. Saya sering mengambil bambu, rotan dari hutan. Jadi itulah saya manfaatkan sampai rumah. Seperti bambu itu kan ada rebungnya, bisa untuk makan, bisa dijual untuk biaya. Kita tidak bisa mengambil bambu seperti rotan dan buah-buahan. Nah, itu juga. Masyarakat di sini sepakat untuk menjaga hutan karena dia pun juga memerlukan hutan. Pernah terjadi bencana alam seperti longsor, hujan besar, puting beliung. Itulah saya takut itu hilang dampaknya, tidak ada apa-apa lagi. Jadi itulah yang saya terus memelihara hutan, saling kompak sama masyarakat.
Thank you for watching that video with me. It's actually a part of a series called Planet Protectors that is up on our website. It's an incredible way to hear stories and lived experiences of those who protect our rainforests and therefore protect your health and my health. So I invite you all to have a look at that as well. When we first started this work, we developed a key method for community engagement that we call radical listening. Radical listening is essentially listening to a group with the recognition that they are the experts. Our process initially looked like this. We would ask communities to identify the drivers of deforestation and its solutions, and then invest precisely in the solutions that we hear. If we are not able to provide the service directly, then we would match solutions with a local provider. And this is an iterative process with a long-term commitment. So it's not one and done. We have a broad phase to identify general solutions, and then a phase 2 to get specifics. And then we check back every few months to see what's working and what's not working for the communities. It's really just listening, but the reason we call it radical listening is because of the action. We do what we are told. And while that shouldn't be radical, it very often is. And even more important to the process of radical listening are the values that underlie it. One of it being interbeing. This is a teaching of Thich Nhat Hanh, who is a Vietnamese Buddhist monk and peace activist that calls that we are all one, in a sense that the different parts of our body are one. Think of it as if your foot had poor circulation, your heart wouldn't withhold blood and wait for payment. It would send blood because your heart and your foot are two organs of the same body. And I think that's what interbeing teaches us on a global level. That if a community in one part of the world and the rainforest is not thriving, then my own community in the city is not thriving either. So rather than seeing this work as charity, we see it as self-preservation of a united whole. The second is reciprocity, recognizing that the communities we work with are not beneficiaries of aid, but seeing them as benefactors. They are protecting carbon that keeps the entire planet healthy and providing a tremendous service. And any funding that we share is a compensation and reciprocal to the type of value that they share. Anti-colonialism is also a central value to us because every community we have worked with have been extracted under colonialism for centuries. So a lot of the work we are doing is really rematriation of stolen wealth. And finally, humility. A lot of us, especially those trained in the sciences or in the global north, are trained to be the experts or the answer givers. And this process requires a lot of internal work to let that go and recognize the experts here are the communities who live in these ecosystems. And the listeners are there coming from a place of curiosity and learning, not from a place of knowledge and expertise. This is a picture of one of the radical listening sessions we did in Madagascar. I was told it was very hot that day, so everyone was taking shade. And this was when the session was over. And in growing as an organization, we also recognize that radical listening would also evolve at scale. So while the core philosophy remains unchanged, deep listening to communities' holistic vision and needs, we are shifting from a process that was primarily led by external health and harmony facilitators into one that is owned and conducted internally by communities and indigenous associations themselves. As I mentioned, radical listening includes investing in their solutions directly. What makes community solutions crucial is their silo-breaking, holistic approaches to planetary health. They see life as a system, unlike many of us who have been conditioned to see them as separate boxes. So communities tend to generate solutions across sectors. From our experience, solutions often touch healthcare, livelihoods, and education. To give you 4 examples, from Indonesia, one of the first solutions we ever learned from radical listening is about a medical center that accepts seedlings as payment. This is developed by the community so that nobody goes without care, even if they don't have cash. From Manumbu in Madagascar, it was intensive rice training to produce more food on less land, therefore improving their nutrition, but also protecting forests from expanding rice fields. In the Apiterewa indigenous region of Brazil, the solution was GIS-supported territorial patrol systems. So using technology and drone to see how their land is doing and also remove land invaders that shouldn't be there. And lastly, from Madagascar, from Ikungu region, reforestation propelled by women's weaving collectives. So there's a very strong livelihood around weaving there. So the Women's Association produce eco-poly bags, which we then buy for seedlings in the nursery, but it also reduces our plastic waste. Since 2007, we've been working through this method of listening to community solutions, and we now support 2.7 million hectares of tropical rainforests across 4 continents by working with 225,000 community members and supporting over 780 hectares of reforestation. We also measure the effectivity of these solutions in terms of carbon, biodiversity, human health, and community thriving as defined by the community. After 10 years of community design solutions with our Indonesian affiliate ASRI, we partnered with Stanford to analyze our impact. The full paper is available publicly with this title, but just a few things that I want to highlight. In terms of forest outcome, in the pink box, you can see that there was a 90% reduction in people relying on logging as a primary source of livelihood. When compared with a composite control across Indonesia, we also saw a 70% reduction of deforestation in the area, which is equivalent to $65.3 million of CO2 emissions averted. Over these 10 years, Health and Harmony and ASRI invested about $5 million in community solutions. So if you calculate it, that's about a 12 times return on investment. Or in other words, for every $1 contributed, communities return $12 of carbon, and that's not yet even counting biodiversity or health. We also used the principle of a dose-response effect to social interventions, and we found that higher engagement with the interventions correlated with lower deforestation, suggesting a potential causal link between the interventions and forest protection. Health was a little bit harder to measure since we don't have the full data, but we looked at differences in healthcare access in communities that work with Health and Harmony through an MOU and those that did not. And we found that villages that have an agreement with us were more likely to access healthcare and have higher number of patient visits. In observing how actual health outcomes are changing, we also saw that diseases, especially infectious diseases, decrease, or as you can see, go to the left, over the 10 years. There was a few increase, specifically respiratory infection and dental disease, but there was a major wildfire in 2015, so we think that might have affected that. And it could also be communities were able to seek healthcare for less critical conditions as access increased. So that's what we think might be happening with dental disease, since the ASRI clinic was the first dentist available in the region. In terms of wildlife, we also replanted a critical corridor called the Sedahan Corridor. You will see here that the Gunung Palung National Park, which is the site in Borneo, Indonesia, is in 2 parcels and is separated. Sorry, I'll continue. It's separated in 2 parcels separated by the belt of rice fields. Hello? Thank you. Connectivity is very important for forests, so this was a key site for reforestation. These are 2 of the patients from the ASRI clinic who paid using seedlings. And then once they're finished in the nursery, we bring them through the peat swamps. And then you can see here a comparison from 2009 and 2014 of the reforestation area. And we also saw an increase in the number of species using this corridor between the 2 parcels of the national park. So just to show some pictures from our cameras, we saw a sun bear, there was the rhinoceros hornbill, and my favorite, the Bornean orangutan. Just my last 3 slides here. Ultimately, I think the biggest learning that I want to share with everyone today is that rainforest communities are inevitably at the heart of planetary health. They are nature's steward, they live in these ecosystems, and they know best how to care for their land. They bring in, holistic thinking and integrated solutions that address all of these different overlapping challenges. What is needed to operationalize this is moving beyond conceptual to action. So moving beyond, one-off consultations, tokenizing communities, treating climate justice as a buzzword into real, tangible changes and action that are led by the communities who are most impacted, but also have the solutions at hand. And this means continuously listening to their expertise, direct funding into the hands of communities, investing in their solutions, and different organizations coming together to support the holistic needs of communities. And as allies to these communities, we must also learn to meet our responsibility to impact planetary health, both within and beyond their territories. I think whether through advocacy or policy influence, or simply having conversations with our communities, how do we look at things like indigenous rights, land demarcation, gender equity, climate policies, the just transition, all of these seemingly different movements as interconnected pieces of the bigger picture. Just a few things here. If you're interested to learn more about radical listening, we do have a free online course with the Acumen Academy that breaks it down in more detail than my presentation. We also, of course, invite you to get involved with Health in Harmony. You can sign up to our newsletter. You can support a Rainforest community today if you would consider giving an individual donation, or you could also follow our socials to learn more about the organization and ongoing initiatives. And finally, my gratitude once again to everyone for listening, for being present in this conversation, and I look forward to the discussion ahead. Thank you.
All right. Thank you very much, Belai, for an interesting presentation, sharing first what is health in harmony, and also what radical listening and innovative and localized solution impact for evidence success and a model for planetary health. Can I invite all the speakers back to the stage, that your camera, so that we can actually see you? And right, okay, let us start with some questions. There are many questions, but I don't think we can go through everyone, but let us see what can we start with. All right. So there are, let me go back to the question. Yes, the question here. So there are many questions for everybody. All right. So let us start first with Dr. Gentle. All right. But first thing is, do we have a clear strategy plan under UNFCCC which precisely indicate or to translate climate justice policy into action?
Shall I respond or?
Yeah. We want you to respond so that we can just go to the second question, which is going to go to Mel, and then we'll come back to you later. Right.
Okay, thank you. Can you repeat the question again?
The question is basically talking at do we have a clear strategic plan under UNFCCC with a precise indicator to translate climate justice policy into action?
As I said before, UNFCCC mentions about climate justice, but it lacks clear strategies about the climate justice and how UNFCCC supports the climate justice. So I think it is the responsibility of the member countries to define their climate justice policy and advocacy strategies on their own. Thank you.
All right, great. Mel, one of the question is basically they want to understand how do you validate the reported death are directly caused by air pollution rather than other environmental, social, economic factors. If you can answer that.
So basically, this is actually a report coming from WHO, but this study was generated coming from the energyandcleanair.org, wherein they set up parameters, most especially in terms of the age group, the effects, for example, on asthma, preterm births, and they also had a lot of literatures related to the pollutants such as NO2, PM2.5, etc. So these data is really coming from a rigorous collection of existing literatures and also a meta-analysis of these parameters. Thank you.
Okay. All right, great. Thanks, Mel. Now we move on to Belai. One of the questions: what is the fundamental differentiating between radical listening from conventional active listening in the context of a community engagement?
Thank you so much. I think radical listening is generally, a form of active listening, but active listening generally is thought as a process for listening attentively to an individual, whereas radical listening is a bit more group-oriented or community-oriented. And again, radical listening also has that specific goal, which is, creating a supportive context for communities to come into agreement about drivers of deforestation, community-generated solutions, and then a key element and must in radical listening is investing precisely and directly into the solutions that emerge from these discussions. So a form of active listening, but there are some very specific next step that I think separates it into radical listening.
So radical listening would include an action after the listening, not just listen and just okay, thank you very much. All right. Should climate justice move back to Gentle? Should climate justice framework prioritize per capita and historical emission over aggravated national emission when assessing responsibility?
Climate justice is now a binding principle for everyone because when the UNFCCC mentions common but differentiated responsibility, that supports the climate justice. And as I said before, the Paris Agreement and IPCC, they have several provisions to support the climate justice. So this is the non-binding, the global principle, as well as the country's responsibility to develop their policies and strategies for climate justice, I think. Thank you.
Okay, all right. Now, Mel, there's a question on responsibility and injustice in emission. Given that small and developing countries suffer the most, what mechanism hold high emission countries accountable for global climate inequalities?
Definitely, there are some mechanisms that are already in place, but one thing is certain that lowering their carbon emissions is really a practical way for them to really support the effects of air pollution and basically other effects of climate change to low emitting countries. But more importantly, as mentioned by Belai also, it's not just about having aid or support, but rather really focusing on concrete solutions. And apart from the support that they should give, for example, the loss and damages, it's really important for them to really act on their emissions. So that is something that I really want to highlight, that apart from giving aid, they should also do their part in lessening their emissions, because after all, it's really in the science that these emissions are creating the effects that we feel, especially in the Southeast Asian region.
Okay, Belai, there's a question on contextual reliance challenges. Are there distinct challenges in fostering climate resilience between forest communities and coastal communities?
Thank you. We primarily work with rainforest communities, so we don't actually have any ongoing partnerships with coastal communities. But I think to some degree there will be similar challenges faced. If I can share also as an indigenous youth and the work that I'm doing with my communities in Borneo, one of the biggest challenge is convincing people that there is value in ecosystem stewardship. We are very much wired to not value indigenous traditional knowledge when it comes to the climate movement. Now there is more recognition, but still recognition alone is not enough. And I think there needs to be, a global shift in how we put value in ecosystems and also those who steward these ecosystems if we want climate just solutions. And this also means, for example, making bridges between traditional and modern sciences, providing platforms for communities to speak for themselves, having the agency to do solutions based on their traditional wisdom with support from the global community. And then particularly funding is always a challenge. Right now, I think less than 2% or about 1% of climate finance goes directly to the hands of communities. Normally, there's a lot of intermediaries and therefore just a very small portion end up in the hands of communities. And even grant models and funding models are very much not grounded in community realities. If you expect, for example, communities to write quarterly reports or make, a budgeting table or whatever, when will they have the time to actually do the stewardship itself? So I think fixing our financing models and finding, alternative blended finance models, such as the one that Health and Harmony is building with our coalition, so that communities are given the time to do ecosystem stewardship. And we use, for example, technology or something automated to help with data that donors want to see. And communities are left with the autonomy to continue, with their everyday life and also practicing their knowledge. These would be some of the challenges I can share.
That's a very important point that I actually also always ask, when people come up to me and ask me for a donation for all this effort, how much of it actually end up to the people that actually need it? So sometimes you just don't donate because or you donate directly to the people? How can people actually donate directly to the one that actually going to be benefit from it?
Exactly.
All right.
I
Okay. Can you? I mean, moving on from that, can the balancing exploitation and development. How can LMICs navigate the tension between being resource rich but economically weaker and the risk of exploitation by high income country while ensuring equitable development? Please, your mic is off. Sorry, gentle.
Oh, thank you. Climate change is also a result of imbalance between development and environmental issues. When the developing countries are exploiting the resources in the name of industrial growth or privatization of resources, so most of the emissions are through as a result of the industrial growth. So how to regulate the unregulated development? How to make a balance between the development and the environmental regulation? I think this is the most challenging issues, and how the emerging economies are now claiming to justify their emissions in the name of development and industrial growth. I think these are the big challenges. But from the justice perspective, where there is low development, where the development is a high need for the developing countries and least developed countries, but they have a very low emission and they are suffering a lot. So that is the matter of justice. So the improper utilization of the resources, privatization is the major causes for the emission, and which is due to the result of imbalance between the development and the environmental regulations.
Yeah, I mean that is great, but LMIC want to develop. I think Belai might be much in nice what can share. You're looking at carbon carbon saving, and between development and saving carbon. So how can we actually what's the balance? So maybe we can stop development, but let us move on to Mel. All right, on citizen power versus policy in action. All right. In settings where governments are indifferent to air pollution, what practical step can individuals or health professionals take beyond the awareness raising?
Yes, definitely. Individual efforts and basically having a clear message is really one of the ways that individuals and health professionals can do. But looking at our example on the Ride for Their Lives, I can see that shared voices is very much important. So one organization cannot just advocate for this. There are many people who can also go together for us to really amplify our voices for clean air. And it is something that we should do, not to work individually, but collectively and collaboratively.
Yeah, but how can individual actually work? Is there any? I mean, from your perspective, you're using a healthcare organization. If
Mhm.
individual that work but the government doesn't actually react, do you have any ideas of how to improve that?
Well, for example, for our communities, we have basically we can have a platform wherein individuals can support, let's say, our initiatives. We have certain what do you call open letters. We also have other ways for individuals to support. And as I've mentioned, usually you have to really work collectively. So individuals must also work collectively in order for them to really have a dent, or what I can say is a larger voice or a bigger voice for the governments to listen, because otherwise individual is not really that powerful in terms of putting what they want to fight for. So looking for allies is something that would really support these types of movements.
Yeah, I think that's very good advice. Finding people with the same or got that
Mhm.
same idea or same objective, and that is very
Yes,
good. I think currently with social media, actually it's very easy for us to find people with same objective.
definitely.
All right, Bella, the question on internal equity within the global south. How can advocates reconcile external demands for climate justice with the internal systemic inequalities and governance issue within their own societies?
Yeah, thank you for that. And also, I think there's a question about how do we decolonize the climate justice agenda. So let me try to
Yes,
put
correct. Yeah.
uh, when you were talking earlier about the dilemma between development and conservation, that's something that countries like Indonesia face on a daily basis. Recently, we moved our capital city to East Kalimantan, and there was a lot of environmental costs that came with that decision. But it all stems from the extractive colonial mindset that I think is just very deeply rooted in our society. And how do we fix our relationship with the earth? How do we actually recognize the value of ecosystems that support our day-to-day life and provide that worldview for governments and policymakers, finance people to adopt, so that we're not operating from an extractive mindset? Because coming back from to Dr. Nicole Redver's quote, we can't fix this issue with the same mentality that caused it. And how do we decolonize then the climate agenda, but specifically even the climate justice agenda? I think comes back to recentering the voices of those who have lived experience. So COP30, I think, would be monumental. Despite all of the feelings I have for COP, it's still going to be a first COP. There's going to be a strong indigenous presence, so I'm very hopeful that could set the tone for what future climate summits should look like. Decolonizing also means addressing the systemic erasure and injustices that these communities face. So giving land rights and giving indigenous rights to communities who have been left behind and forgotten and excluded for so long. Moving away from tokenism, allowing communities to lead, going beyond recognition, resourcing these people. And I think also just calling on each of us to do that liberation work and that reparation work, and decolonizing ourselves before decolonizing the systems that we operate in.
I mean, the word decolonization is very, very strong, very, very important. But our current system is rooted on this. Our United Nations, WHO are all rooted on the basis of colonization. How can we actually go beyond that? I think that is something that we need to think about, every one of us here. Whether we still want to look at development from the GDP perspective. Every year there should be a development. If not, then the country would be considered not performing, or the prime minister not performing. What do we want to do about that? I think the time is almost up. Can we have a final words? We starting with Belai, then Mel, and then we close with Djandam.
I would just repeat the title of my presentation, regenerating rainforests by listening to communities, but maybe drawing that to a larger context of advancing climate justice, advancing planetary health, and finding solutions for the climate crisis by listening to communities, centering their experiences and expertise in the work that we're doing for an equitable world. Thank you.
Yes, radical listening. That's something I learned today. But to be radicalized. Let us move to Mel. What is your last thoughts?
Of course, I will stay true to the mandate of healthcare without harm. And the idea of having the health sector be involved in the conversations of climate stems from the idea that we should do no harm. That at the end of the day, we are here to support our people, but at the same time, as a responder, we should not be the contributor to the effects of the health sector to the climate crisis. So with that, I instill that value that in all aspects of our work, we should do no harm.
Very good advice. That basically, greening the health sector is very difficult to do because health sector contribute actually a lot of greenhouse emission. And how do we green the health sector? That is something that we can actually work on. Djandam?
Thank you. So my final word would be the climate justice is an agenda of equity, justice, and human rights, not at the global level, but the equity, justice, and human rights issues related to climate injustice starts from households, community, and national level. So the national policies, social norms are also equally responsible to address the climate injustice when we practice the climate actions. Thank you.
Yeah, thank you very much. Thank you everybody for contributing. This session underscored the urgent needs for Center for Justice, Equity, and local voices to be heard, all right, in climate action. From strategic policy design to grassroots engagement and insight shared by Djandam, Mel, and Belai. I think moving forward, we need to have effective climate justice with dependent on our collective ability to hold powerful actors accountable, support local-led solution, and elevate health professionals as advocates. Thank you very much. Let us continue listening, engaging, and acting. All right. Thank you, everybody, and have a nice day. We will see you again in a week's time for the 11th and final session. Bye. Good night.